Good afternoon, and thank you for joining us here today. Before I begin, I would like to acknowledge that we are gathered on Treaty 1 territory and that Manitoba is located on treaty territories and ancestral lands. We acknowledge Manitoba is located on the homeland of the Red River Métis. We acknowledge northern Manitoba includes lands that were and are the ancestral lands of the Inuit. We respect the spirit and intent of treaties and treaty making and remain committed to working in partnerships with First Nations, Inuit, and Métis people in the spirit of truth, reconciliation, and collaboration. I'd like to thank everybody for joining us here today at this different venue. We had an outbreak at the venue that we had planned to, so therefore we readjusted and had it here at the Legislature. My name is Scott Johnston, and I'm the Minister of Seniors and Long-Term Care. I would like to thank David Driedger, Chief Executive Officer of HavenGroup, and Kevin Scott, Chief Executive Officer for Deer Lodge, Middle Church Home, and River Park Gardens for joining us here today. I would also like to welcome Gina Trinidad, Regional Lead of Continuing Care and Community Health Services with the Regional Health Authority. Thank you to all of our guests for joining us here today. We know Manitobans want and expect a government that acts with integrity, compassion, and puts their needs first. Our government is committed to focusing on priorities of Manitobans as we continue to work together to build a healthier, stronger, and more prosperous province. We are committed to strengthening and realigning our healthcare system to ensure Manitobans can assess and get the care that they need now and well into the future. This is why the Department of Seniors and Long-Term Care was created with a focused agenda to implement all recommendations of the Stevenson Review. In October 2020, an outbreak was declared at Maples Long-Term Care Home in Winnipeg. In November 2020, the Manitoba government engaged Dr. Lynn Stevenson, an expert advisor, to review this outbreak and provide feedback and recommendations to prevent future tragedies across Manitoba. The Stevenson Review made 17 recommendations for how to address the concerns as identified. The implementation plan was created and 13 working groups were established with representatives from the Regional Health Authority, Shared Health, private and not-for-profit long-term care facilities, personal care home operators, and personal care home associates. Our Premier actually initiated the Stevenson Review in her former role as Minister of Health and Seniors Care. I will now pass it over to Premier Stefanson to discuss the results of our final report. Premier.
Thank you very much, Minister Johnston, and thank you everyone for being here today. This afternoon with us. I want to welcome David Driedger, who's here with us today, as well as Kevin Scott as well from River Park Gardens. Thank you, both of you, for being here today, as well as Gina Trinidad, who's joined us. So thank you. First off, I want to acknowledge the update from the National Advisory Committee on Immunization, known as NACI, that was issued late yesterday with respect to their recommendation on a fourth dose. We will be following NACI's recommendation, and Manitoba will be offering a second booster dose of COVID-19 vaccine to residents of personal care homes and elderly persons housing congregate living sites, regardless of their age. Individuals age 70 or older who live in the community, and First Nations, Inuit, and Métis people age 50 or older, regardless of where they live. The second booster will be offered as early as mid-April and remain available over the coming months. And Dr. Roussin will provide a further update on more details later on this week. We know that vaccination is our best defense against this virus, and I encourage all Manitobans to get fully vaccinated if you have not already done so, including a third dose when eligible. Our seniors have helped shape our beautiful province. They've worked hard, they have sacrificed for their families and given back to their communities, and they deserve our love, compassion, and utmost care. We know that the COVID-19 pandemic has impacted our seniors more than anyone else, and tragically we saw those impacts in our long-term care homes, where systemic issues contributed to some seniors losing their lives. Following the Maples Personal Care Home COVID-19 outbreak in November of 2020, our government took immediate action and commissioned an external independent review led by Dr. Lynn Stevenson. Following her comprehensive review of Manitoba's long-term care system, we accepted all 17 recommendations, and an implementation plan was created and working groups were established to develop timelines for planning and implementation of these 17 recommendations. Additionally, earlier this year, I was pleased to welcome Scott Johnston as a member as Minister to lead the new Department of Seniors and Long-Term Care, which has been tasked with following through on all recommendations of the Stevenson Review and strengthening seniors' care all throughout Manitoba. And that is what brings us here today. As part of Budget 2022, our government is proud to announce over $15 million as an initial investment to support the implementation of the recommendations and to strengthen the quality of care for Manitoba seniors. This initial $15 million investment will support enhanced infection prevention and control within the long-term care sector. This includes a provincial program manager, regional leads, and 50 infection control staff. Additional allied health and housekeeping staff, and information and communication technology improvements to better support operations and patient care. As well, over $260,000 will be dedicated to strengthening capacity for quality and standards officers, as well as protection for persons in care office capacity. This funding will also support better integration of personal care homes within the broader health system by permanently establishing a provincial personal care home liaison to lead stakeholders in developing and maintaining a better system of communication, planning, and collaboration across our healthcare delivery system. Today, we are also sharing the final report of the Stevenson Review, which contains the work plans and deliverables that will see the full implementation of all 17 recommendations. I am pleased to share that many improvements are well underway, and today's announcement is an important step to fulfilling our commitment to do just that. I want to take this opportunity to thank the working groups and the steering committee for their critical work to identify solutions to strengthen the quality of care for seniors in our province. To all the staff in Manitoba Personal Care Homes, thank you for your compassion, dedication, and commitment to the residents and families within personal care homes. Today is an important step in our commitment to strengthening seniors' care throughout the province, and I look forward to sharing more good news very soon. Thank you very much.
Thank you, Premier. I would like now to call on David Driedger, CEO of the Havenwood Group and a member of the Stevenson Review Steering Committee, to the podium.
Premier Stevenson, Minister Johnston, invited guests. It is truly a pleasure to be here today because of the significant milestone we find ourselves. I want to commend the Government of Manitoba for its significant initial investment and longer-term commitment in strengthening and increasing the capacity of care for seniors in our personal care facilities throughout this province. It is truly a watershed moment, and one that residents and family, staff, and over 100 personal care home operators look forward to. I am reminded that how we take care of seniors today is truly an expression of our gratitude toward the generation that has gone before us and has contributed to the success of this province. Premier, in response to your announcement, I would like to note a few key points. We recognize that these are significant investments, allowing stakeholders to address priority areas that really do require attention. So as operators in the systems, with this plan initiated, we can proactively plan, grow capacity, and align our human and other resources and processes to best meet the needs of residents, families, and staff. We believe that this multi-year initiative will strengthen and transform everyday care of residents in personal care homes. We are encouraged that the measures put in place will also make the healthcare system more responsive, not just for everyday and growing care needs of residents, but for times of operational challenges such as we have experienced over the last few years. The commitment by government to resource the system to enhance staffing in direct care and other support areas and allied positions is commendable. And lastly, we are pleased that the Manitoba government has provided support for the provincial personal care home liaison office, whereby a voice of varied stakeholders can be heard, and that dialogue on matters such as senior care in long-term care facilities is heard. Once again, thank you, Premier, for your endorsement of the Stevenson report recommendations and the corresponding action plan that had a broad-based input from involved healthcare workers across the system. Residents, families, and staff in long-term care and personal care home operators all look forward to a strengthened and responsive healthcare system for seniors in Manitoba. We look forward to continue to working with the service delivery organizations and with government to see this action really fully realized in the days ahead. Thank you very much.
Thank you, David, and I must correct myself. I said HavenWood. It should have been HavenGroup. Thank you, David, and I'd like to welcome Gina Trinidad, the Regional Lead Continuing Care and Community Health Services with the Winnipeg Regional Health Authority. Gina?
Premier Stevenson, Minister Johnston, thank you so much for having me to, as part of the Winnipeg Regional Health Authority, but also as the representative from the Stevenson Steering Committee, as well as the Long-Term Care Leadership Group here in Winnipeg. Good afternoon. I would like to begin by sharing with families of personal care home residents, particularly those who have lost loved ones to COVID-19, just how deeply and sincerely that I and all healthcare providers grieve the loss of residents over the course of this pandemic. COVID-19 is one of the hardest and most relentless challenges we have ever faced as community members, family members, and as healthcare providers. That is why it is so hopeful and important to hear this announcement today. On behalf of the WRHA, I want to thank Premier Stefanson and Minister Johnston for their commitment to the implementation of all of Dr. Stevenson's recommendations. As a nurse and a leader in the long-term care sector for many, many years, I am heartened by this commitment of support with first, a dedicated seniors and long-term care division in Manitoba, strengthening the collective voice of long-term care residents, their families, staff, and operators. The announcements today will bolster staffing resources to ensure residents receive safe, quality care in a personal care home environment of their choice. Finally, I want to acknowledge the extraordinary service healthcare providers who continue to provide every day the care and safety for residents despite the ever-challenging challenges of COVID-19 and all of that, the challenges that creates. They are exhausted and at times worried, but they persevere. For that and all they do, I extend our sincere gratitude. Thank you so much for allowing me to be part of the announcement today, a really important step for all seniors in Manitoba.
Thank you, Gina. I want to take the opportunity to recognize Kathy McPhail, Chair of the Stevenson Implementation Oversight Steering Committee, and to thank her for her work. Kathy has worked closely with our new department, and as the new minister, I can tell you I appreciated her input very much. A reconstituted committee has just had their first meeting, and we thank them in advance for their ongoing leadership, commitment, and dedication to overseeing the full implementation of the recommendations of the Stevenson Review. This steering committee reports to my deputy and ultimately to myself as minister. This announcement today reinforces our government's commitment to seniors in our province. I would like to take this opportunity to reiterate that the Department of Seniors and Long-Term Care was created with a focused agenda by our Premier to implement all recommendations of the Stevenson Review. This is not a responsibility that I as Minister take lightly, and I look forward to seeing this through to completion for our seniors. I thank you, and we'll now go to questions.